Hello viewers, this is your primary or preventive healthcare advocate Bernard Agbonoshi. You can simply call me Bernard G's. I am the founder and the director of the health organization Bernard G's Preventive Health Education. I'm also the author of the public-friendly medical book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. I am a nurse clinician and I work in one of the teaching hospitals in the country. I welcome you to another discussion of a disease topic. We have already looked at other major disease topics like hypertension, diabetes, and sickle cell disease. I encourage you to visit my page on Facebook at Bernard G's Primary Healthcare Media and watch my previous video presentations on those topics. You can also visit my YouTube channel at Bernard G's Primary Healthcare Media and then watch the video presentations. Our current disease topic for discussion is kidney disease and kidney failure. But before we move on, let me show you this. You see this book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. The role of public medical knowledge in disease prevention and treatment. All the topics that I have been talking about, or the topics that I treat, and how I present them are in this book. This is a book I wrote specifically for the general public or non-health professionals. It is a book I wrote in support of my primary or preventive healthcare efforts in the communities. This means that it is very easy to understand. Anybody who can read or listen to it will be able to understand it. I encourage you to get a copy of this book at home and read. It will help you a lot today or tomorrow. It will help a loved one today or tomorrow based on the knowledge, the medical knowledge that you acquire. We should not leave medical knowledge or understanding to only health professionals. I intentionally or carefully selected disease topics that require proper medical knowledge of the general public or the individuals to effectively prevent them or properly manage them. So it is a book that all of us need. All of us need proper basic medical knowledge. So get in touch today and have a copy of this book at home. It will help a lot. It is a beautiful thing to have your children read a book like this. It's going to help them as they grow older. So get in touch with us now and grasp your copy wherever you are in the country. Wherever you are, we'll be able to deliver to you, whether here or abroad. Get in touch today and have a copy at home. Thank you. The main topic, kidney failure and kidney disease, or kidney disease and kidney failure. One will say, why do I say kidney failure and kidney disease? Well, they are not the same thing. Kidney disease and kidney failure are not the same thing. So stay with me to get the understanding on both. Before we move on, let's look at the organ kidney. What is the function of the kidney? The kidney is one of the most important organs in the body system. Any problem with the kidney will eventually lead to problem in the entire body system. So let's look at some key functions of the kidney which will help us to appreciate the danger posed when the kidneys fail. One main function of the kidney is to regulate the amount of fluid within the body. So the kidney helps to maintain fluid balance within the body. If there is excess fluid in the body, the kidney eliminates the excess fluid in the body through urination. So you see that when the weather is very cold and you take in a lot of water, you end up passing a lot of urine. You end up passing urine frequently. That is a way the kidney is using to eliminate the excess fluid in order to have the right balance of fluid within the body. And you also realize that when you have not taken in water for a very long time, you don't easily pass urine, you don't feel like urinating. That is the job of the kidney. So the kidney prevents you from urinating so that you will not lose excess fluid or further fluid from the body system. So if there is not enough fluid within the body system, the kidney will not let you pass urine frequently to conserve the fluid within the body, which is not already enough. If there is excess fluid or enough fluid within the body which must be eliminated, the kidney will encourage frequent urination. So it does that in order to maintain the right balance of fluid within the body. Another key function of the kidney is to remove chemical waste from the body. There are a lot of chemical waste generated within the body system, which must be eliminated. Failure to get rid of these chemical waste will eventually become injurious to the body system. So how does the kidney remove how does the kidney remove chemical waste, these chemical waste generated within the body? It does that through urine, through passing of urine. You see that when you urinate, every one of us urinate. So when you urinate, you see that the urine has color. The urine is not colorless. Sometimes the urine has a certain color and sometimes the urine is colorless. When you urinate, that color of the urine is as a result of the chemical waste dissolved in it. So the chemical waste generated within the body is eliminated through urine or through urination. So it is the chemical waste within the body which the kidney is eliminating that's dissolved within the fluid parts of the elimination to give it such kind of color. Other functions of the kidney include regulating blood pressure. The kidney controls the production of what? Blood cells, red blood cells. So these are the important functions of the kidney. What is kidney disease? Kidney disease means the kidney performs less of the functions that we have talked about already, which are excretion of metabolic waste from the body system, balancing of fluid within the body, and others. So when we say kidney disease, it doesn't mean that the kidney is no more working or is not functioning. It is functioning, but it is not at its maximum level. The function of the kidney is not 100% efficient. Then we say kidney disease has occurred. This means that the loss in the function of the kidney, the gradual reduction in the function of the kidney is progressive or it is gradual. It doesn't happen all of a sudden. Then we can say kidney disease has occurred. So if any disease is gradual, it is not sudden, then we can call that disease chronic. So we have chronic kidney disease. We have chronic kidney disease where damage to the kidney leading to reduction in its function is gradual or it is progressive. For this reason, we have about 5 stages of chronic kidney disease, where the reduction in the function of the kidney is from one stage to the other. Let's look at the stage 1 chronic kidney disease. In stage 1 chronic kidney disease, the kidney function is, let me say, almost 100%. The kidney is all right, it is working normal, everything is fine with the kidney. But laboratory investigation will show that there is a problem within the kidney. Yes, in stage 1 chronic kidney disease, the kidney is working all right, but medical investigation will show that there is a problem with it. So with stage 1 chronic kidney disease, the person will not experience any signs and symptoms that will suggest that there is a problem. The person is urinating all right, everything seems to be fine, but laboratory investigation will reveal that there is a problem with it. And if the stage 1 chronic kidney disease is not detected early and nothing is done about it, then it moves to stage 2. And in stage 2 chronic kidney disease, the reduction of the function of the kidney is to about 90%. So the efficiency of the kidney is about, let me say, 90%. So over year 2, the kidney is working all right. The person will not experience any signs and symptoms to show that there is something going on within the kidney. But laboratory investigation will show that the function or the efficiency of the kidney has reduced to, let me say, 90%. And if nothing is done about it, if it is not controlled, then it moves down, it moves up to the next stage, which is stage 3. And in stage 3 chronic kidney disease, the efficiency of the kidney will reduce to about 60%. Over here, the kidney is working, but to a level of, let me say, 60%. Over here, the person might not experience some signs and symptoms to show that there's a problem. If the person will experience some signs and symptoms, that it will be in the form of swelling of the legs or hands, or if the swelling is serious, it could also happen in the face. The person might experience nausea. The person will have problem with sleep. So that is the stage 3. The stage 3 chronic kidney disease. The person might experience some signs and symptoms associated with chronic kidney disease. And if nothing is done about it, if the chronic kidney stage 3, nothing is done about it, it moves down to stage 4 chronic kidney disease. In stage 4 chronic kidney disease, the efficiency or the function of the kidney will be reduced to, let me say, 30%. Over here, there are a number of signs and symptoms. The patient or the person will begin to experience some signs and symptoms to suggest that there is a serious problem going on within the kidney. Over here, the person will have reduced urine volume, or the person urinates excessively. There are a number of signs and symptoms with stage 4 chronic kidney disease. We have fatigue. The person easily feels tired. The person finds it difficult to sleep, which we call insomnia. There is itching. The person will also have difficulty in breathing. The person will begin to have swelling in the hands or feet. So these are some of the signs and symptoms with stage 4 chronic kidney disease, because there is significant damage to the kidney and there is significant reduction in the function of the kidney in stage 4. And if nothing is done about it, in stage 4 chronic kidney disease, if nothing is done about it, the disease is not controlled at that level, then it moves to stage 5 chronic kidney disease. And stage 5 chronic kidney disease is the last stage of the disease, and that is what is called kidney failure. So stage 5 chronic kidney disease is what we call kidney failure. Over here, the function of the kidney has reduced so much that it can no more sustain the person, and something extra must come in to help in the function of the kidney. That is elimination of metabolic waste, balancing of fluid within the body. So in the stage 5 chronic kidney disease, there is significant damage to the kidney. So we end up having kidney failure. So kidney failure is when the kidney can no more perform the functions that we have earlier on stated. So you see the difference between kidney failure and kidney disease. So the kidney disease, the kidney is working all right, but we have reduction in the function of the kidney. But in kidney failure, the kidney can no more perform those functions. So kidney failure is also called end-stage kidney disease. There are a number of signs and symptoms with stage 5 chronic kidney disease or kidney failure or end-stage kidney disease. A person with this stage of the disease experiences these signs and symptoms, which are very, very serious. We have difficulty in breathing. They find it difficult to breathe and they have to be supported on oxygen. They also have swelling in many parts of the body. They experience difficulty in sleeping. They find it difficult to sleep. A person with stage 5 chronic kidney disease experiences serious itching on the body. They also experience confusion. So these are some of the signs and symptoms associated with this stage 5 chronic kidney disease. And if nothing is done about it, the signs and symptoms alone are serious enough to cost the life of the patient. And this is basically due to the fact that the chemical waste within the body are not being removed by the kidney. These chemical waste, when not removed, become toxic in the body, and it can cause serious life-threatening situation for the individual. Let's look at the management of chronic kidney disease. Management, because as it stands now, we do not have cure for chronic kidney disease. There is no drug that you can take to cure kidney disease or chronic kidney disease. So those of us who listen to these herbalists, they often tell people they have herbal drugs that they can take to cure chronic kidney disease or to restore fully the function of the kidney. Well, that is not true. These herbal drugs are powerful chemical agents, and they rather cause more harm to the kidney. You see, when one is taking some drugs, certain drugs, when a person urinates, you see that the urine color looks like the drug. Yes, the urine color changes dramatically as a result of taking that drug. So it is the kidney that is eliminating part of the chemical side of the drug, which is chemical. So when the kidney is already having issues, the kidney is having issues with its role, which is the excretion of chemical waste from the body, and you are now going to take in these powerful herbal drugs. So you are putting more pressure on the kidney, you are giving more work to the kidney instead of trying to help restore it. So people who abuse these herbal drugs, people who take these drugs excessively, they end up developing end-stage kidney disease, or they end up getting to stage 5 of the disease, that is chronic kidney disease stage 5, which is the kidney failure. So a lot of people come to the hospital, they come on admission with end-stage kidney disease or chronic kidney disease in stage 5 as a result of abuse of these herbal drugs, which are powerful chemicals that the kidney needs to eliminate from the body, and it cannot do so because it is already having problem. So taking these drugs will rather worsen the situation of the kidney and quickly lead the person to getting the worst form of the disease, which is stage 4, stage 5 of the disease. The goal of managing chronic kidney disease is to slow the progress of the disease from one stage to the other. So if it is stage 1 chronic kidney disease, the goal of management is to slow the progress of the disease to stage 2. If it is stage 2 chronic kidney disease, the goal of management is to slow its progress to stage 3. And another goal is to control the signs and symptoms of the disease. Because I said earlier, the signs and symptoms alone of the disease can be fatal. For instance, a chronic kidney disease having difficulty in breathing, a chronic kidney disease having swelling in many parts of the body, these signs and symptoms must be controlled, they must be managed so as to help the patient to cope. Another goal of the management is to reduce the risk of developing complications out of the disease. So these are some of the goals of managing chronic kidney disease, and if it is done properly, it is going to help the patient a lot. With the management of chronic kidney disease, we need to look at the cause of the disease, the factors that contribute to the disease. As I said earlier in our presentations on diabetes and hypertension, these two diseases are grave risk factors of chronic kidney disease. It is easy for someone with uncontrolled hypertension to develop chronic kidney disease. It is very easy for someone with uncontrolled diabetes to develop chronic kidney disease. Someone with liver disease can easily develop kidney disease. So to properly manage chronic kidney disease, we need to go back and look at some of the disease conditions, because the disease is actually caused by other disease conditions. So we need to focus on the other disease conditions that contribute to the development of the disease. So if a chronic kidney disease patient is having hypertension, then the hypertension must be properly managed. manage the hypertension properly in order to control the chronic kidney disease, or in order to slow the progress of the disease from one stage to the worst stage. If the person is having diabetes, then properly manage the diabetes in order to slow the progress of the disease from one stage to the other. If it is liver disease, it should be properly managed. So this is how we manage chronic kidney disease. Another management step is diet. You see, the food that we consume have chemicals in them, and the kidney has to work to eliminate the harmful side of the chemical out of the body, and the kidney is already faulty. So a chronic kidney disease patient must be very careful with the sort of food he or she consumes. That is why when you eat certain food, you end up again urinating, having the color of the urine like the food that you ate. So the kidney is eliminating part of the food element from the body. Here is the case that the kidney is having issues with its elimination role. So we need to be more careful with the consumption of food. A chronic kidney disease patient should eat food freshly prepared. The food should be prepared from the scratch instead of going to buy food outside or from the shop or canned food. A chronic kidney disease patient should eat more of such freshly prepared food, because he or she has more control over the sort of things used in the food. Another point is a chronic kidney disease patient should limit the intake of salt. Yes, we made mention earlier on that the kidney helps to regulate the right balance of fluid within the body, and a faulty kidney will not be able to eliminate excess fluid from the body. So taking in salt will rather worsen the case. Taking in salt helps the body to retain more fluid, which the kidney is having issue with removing or eliminating from the body. Salt is one thing that helps the body to retain fluid. So if someone is having issues with the kidney, where the person is having swelling as a result of fluid accumulation within the body, taking in salt will worsen the case. A chronic kidney disease patient again should limit the intake of protein. Yes, they shouldn't take too much protein because it will not help with the situation. A chronic kidney disease patient should be more careful with the sort of food they take, especially these canned food. It is more advisable that a person with chronic kidney disease see a professional dietitian to guide him or her on the sort of food he or she should eat, because many of the food have certain chemicals which are just not good for a person with chronic kidney disease. One chemical is potassium. It is not good for a chronic kidney disease patient to eat food rich in potassium. So seeing a professional dietitian will help to guide the person to select the sort of food that will just meet the nutritional needs or value, so as not to put pressure on the kidney to eliminate some of these chemicals out of the body. So these are some of the ways to manage chronic kidney disease. The ways to manage chronic kidney disease to slow down the progress of the disease from one stage to the worst stage, to manage or to control the signs and symptoms of the disease, and also to reduce the risk of the complications that come along with the disease. These are some of the management steps that a person can take. So one of the best thing, or the first best step, is to recognize the disease at the earliest stage. As I often say, diseases progress in stages. Sometimes when you are told you have issues, health issues, you may not immediately feel the hit from the health problem that you are told you were facing. Some of these diseases progress in stages, as I do say. So when you are sick, it doesn't mean that the disease will go away because you are not feeling seriously ill at that moment, but the disease is over there in your body, working itself out gradually to finally cause serious harm, irreversible harm to the body. And that is how chronic diseases are. So one of the most important things you can ever do for yourself, should you in case be told that you have issues with your kidney, please take it very seriously. Take it very seriously and properly manage it, because chronic kidney disease will not give you problems at the initial stage. That is how most chronic diseases are. You may not feel the heat of the disease at the initial stage, but it is working itself out gradually, progressively, and that is why we call them chronic diseases. So by chance you are told you have issues with your kidney, kindly take it seriously and start the management goal and make sure you properly manage it to slow the progress of the disease from one stage to the other, so that you wouldn't have to wait for the disease to progress from one less stage to a more serious stage where management becomes very difficult and expensive. Now let's look at the management of kidney failure or stage 5 chronic kidney disease or end-stage kidney disease. One major additional management plan to chronic kidney failure, and that is when the disease advances to the last stage, which is stage 5, is dialysis, to undergo dialysis. Dialysis is a medical procedure where a machine, a very powerful medical machine, assumes the function of the kidney, which is to eliminate waste, chemical waste generated within the body. So in kidney failure, as I said earlier, the kidney can no more perform those core functions that we have mentioned earlier on, that is eliminating chemical waste from the body. And these chemical waste, when accumulated, become very dangerous to the health of the body. So failure to remove these chemical waste from the body system can even kill the patient. So the dialysis machine, which is a very powerful a very powerful medical machine, assume the role of the kidney to clear out those chemical waste out of the body. So dialysis is an expensive medical procedure, and this is what makes the management of stage 5 chronic kidney disease or kidney failure very, very expensive. And not many people can afford this procedure for a very long time. And it is a stage of the disease that you cannot do away with this procedure, this medical procedure of removing metabolic waste or chemical waste out of the body system. You cannot avoid this medical procedure at this stage of the disease, which is stage 5 chronic kidney disease. So if a person gets to this stage of the disease and then the procedure is not forthcoming, the dialysis procedure is not done, in no time the person may pass away. The person may pass on in no time, because the body will not be able to handle the massive amount of chemicals generated within it if it is not removed, or if it is not being removed. That is the big problem with stage 5 chronic kidney disease. So you see that when someone gets to stage 4 chronic kidney disease, the medical team will then prompt the family members to prepare for dialysis. So this is the danger associated with not properly managing chronic kidney disease to slow the progress from one stage to another worse stage. This is the problem associated with it. So if you don't want to find yourself in that stage of having a machine to help you maintain your health, let me say even your life, then take very good care of your kidney. It is one of the most important organs in the body that we all must always protect. We also have this acute kidney failure. Any disease that is acute happens suddenly with devastating effects. So acute kidney failure is just like end-stage kidney disease or stage 5 chronic kidney disease, where the kidney can no more perform those key functions that we have already looked at, which are eliminating chemical waste from the body system, balancing of the right fluid within the body. So the kidney can suddenly shut down. The only difference between acute kidney failure and end-stage kidney disease or stage 5 chronic kidney disease that acute kidney failure can be reversed. Acute kidney failure can be corrected. That is, if what caused the kidney to shut down can also be corrected. So there are a number of factors that can cause the kidney to shut down suddenly without the person already having history of kidney problem. One thing is anything that can reduce drastically the flow of blood to the kidney can cause the kidney to fail. So we can have acute kidney failure if there is drastic reduction of blood flow to the kidney. For instance, if someone is involved in serious road traffic accident and the person lost so much blood, it can cause the kidney to fail. There are certain diseases or infections that can suddenly shut down the kidney. Certain infections can suddenly shut down the kidney. When there is direct injury to the kidney, it can cause it to shut down. For instance, a person has taken too much of very powerful drugs. It can cause the kidney to shut down. For instance, again, a young man, let me say about 20 years, came to the hospital with acute kidney failure because he mistakenly took camphor, that white substance, which was able to shut down the kidney. But the only good news about acute kidney failure is that it can be reversed if what suddenly shuts the kidney can be taken care of. It can be reversed. That's the difference between stage 5 chronic kidney disease or end-stage kidney disease and acute kidney disease. An ultimate treatment plan for kidney failure is kidney transplant. Yes, I think we have been hearing about kidney transplant of late because of how young people suffer kidney failure and they have to either receive a new kidney or they end up passing on. So kidney transplant is the ultimate treatment plan for kidney failure. And it is not a common procedure because it's difficult to get a donor and it is a very serious surgical procedure or medical procedure. God in his own wisdom gives everyone 2 kidneys. So every individual has a pair of kidneys, and I believe due to the important role that the kidney plays. And one good news is that one kidney is just enough to perform its crucial roles. The 2 kidneys that every individual has, one is just enough to perform the important roles that we have looked at earlier on. So someone with 2 healthy kidneys can give out one to someone who has issues with the 2. You see, the problem with chronic kidney disease is that, or the problem with kidney failure is that both kidneys have issues. Yes, both kidneys have issues. So one will say, okay, so if someone's kidney fail, let's check on and then take out the one that is having problem to have the other that is not having problem. But the issue is with kidney failure or chronic kidney disease, both kidneys are damaged or they are having issues. So the person will either have to get a new replacement or the person will have to manage the condition, especially if it is in stage 5 with a dialysis procedure that I have mentioned earlier on. So that is the problem with the kidney disease. The 2 kidneys end up having issues. A person with 2 healthy kidneys, as I said, can give out, can donate one of his or a healthy kidney to someone who is having kidney failure, someone who is having both kidneys damaged, so that that one kidney in the donor will work perfectly, and then that one kidney in the patient will also work perfectly. That is how it is. Now let's look at the last thing, which is prevention of kidney disease. As I said earlier on, kidney disease cannot be cured. It either is managed or it is prevented. So how can we prevent kidney disease? We have looked at the risk factors of the disease. We have looked at certain things that easily contribute to the disease. And we earlier on said that there are chronic disease conditions or there are other disease conditions that can easily make someone to get kidney failure or chronic kidney disease. So to prevent kidney disease, we have to focus on those diseases that easily make someone to get the disease, chronic kidney disease. We made mention of diabetes, we made mention of hypertension, liver, and other factors. So to prevent kidney disease entirely, we have to be more conscious about our health holistically. We have to take holistic approach to maintaining excellent health so as not to have issues with the kidney. Another thing too that we can do to not find ourselves having problem with the kidney is to watch our diet, is to watch the sort of food, the sort of things that we take in. Another thing that I can also add is we should avoid the abuse of drugs. Many a time it's easy for someone to tell you, oh, I'm not feeling well, give me drug. It's easy for someone to say, oh, Papa doctor, I'm not fine, so give me drug. But one thing that I would like to say is that every drug, I would say, is poison. It depends on how it is taken. That is why there are drugs that it is only the doctor that can prescribe it, so as to help the person get the right amount. Every drug that gets into the body system, if care is not taken, can be injurious to the body instead. So it shouldn't be fun for us to say, okay, I'm not feeling well, so I'm going to get drug. How do you know that that drug that you are taking is meant for that kind of sickness? So we have what we call contraindication. Contraindication is when a patient is having a particular disease, a particular drug is needed to properly take care of the disease. But due to other health issues, the drug cannot be given. Because when the drug is given, it's going to worsen the overall situation of the patient. So we have what we call contraindication. So the drug will not be given at all. So to properly care for our kidney, we need to stop the abuse of drugs. Those of us who enjoy taking herbal concoctions, we have gallons of herbal medicines that we take. I have seen a number of people who develop chronic kidney disease as a result of excessive use of these herbal concoctions. They are powerful chemicals that the kidney has to overwork to eliminate. It gets to a point it will get overwhelmed. So with the mind of maintaining your health or taking care of your kidney, you rather end up destroying the kidney. So let us be very careful with the use of drugs. Every drug in a way is toxic. It all depends on how it is used. So we should not be quick to go to drugstore, buy drugs to take because we are not feeling well. If you are not feeling well, go to the hospital, let them examine you and give you the right treatment, the right drug that will just target your ill health to make you well. That is why I don't really listen to anyone who tells me I'm sick, so give me drug. It is illegal for any health professional to give out drug outside the hospital without prescription or without documentation. It is illegal for anyone to provide drug. So people who have been selling these drugs in cars, in the stations, what they are doing is illegal. People who advertise drug on television and other media outlet, it is illegal to do that. Well, this is the end of our discussion on kidney disease. I hope you have learned something. I encourage you to continue being health conscious. I encourage you to continue listening to good source of health information, because primary or preventive health care first of all requires what? Arming yourself with proper health knowledge. A lot of people out there are doing things that rather put their health in danger, all because of misinformation on health-related issues, or because they do not have the proper knowledge on health issues. So continue to visit my page on Facebook at Benagee's Primary Healthcare Media and watch my previous video presentations on disease topics. You can also visit my YouTube channel at Benagee's Primary Healthcare Media and watch the video presentations. Invite your friends and loved ones to the page to watch the video presentations on various disease topics. It will go a long way to help all of us. Thank you once more again for your time with me on this particular disease topic. Until then, always remember your health is your wealth. Before I leave, this book I said earlier on I wrote in support of my primary or preventive healthcare effort in the communities. All the topics that I present are in this book. So you will get much more when you have a copy of this book. So I encourage you to get in touch with us to have a copy of the book. Just get a copy at home. Once in a while, you glance through to pick something.